from the station that's on your side. This is Channel 7 News Daybreak.
We're talking allergies this morning because 50 million Americans suffer from allergies, many of those here in Arkansas. Joining us now is Dr. Laura Lester with Baptist Health Family Clinic in Malvern, and today we're talking about allergy testing. Dr. Lester, something that you've gone through, a lot of people have gone through before. You said you're an East Texas girl, so it was only pine trees growing up, and then you moved to Arkansas, you go to the U of A, and you were just inundated with oak and grass and all these different things.
Timothy grass,
Timothy grass,
I don't know. I didn't know what that was, but...
Now, can you get tested for that stuff?
Yes, that's how I found out.
Okay.
So when I was in residency, my allergies were terrible, and I went through this allergy testing process, which I'm going to tell you about, and found out that I was allergic to pretty much every tree and grass that there is, other than pine, which is East Texas. So that's why it didn't flare up until I came to Arkansas, I guess.
And it might happen to other people like that too, right?
You know, when that's one of the indications is, you know, you're having the allergy symptoms, but also if you're moving from one place to another and your allergies flare up, it's probably because you're in a place where you're allergic to more things than, you know, if you have a change in location, that's an indication.
And that's why testing is a good idea, right? Yeah.
Yes.
So how would one go about testing, and how does it work?
Testing isn't for everyone. It's for, you know, if you're just a seasonal allergy person where you can take a allergy pill every now and then because you're having symptoms, and that's not for you. If you're taking them year round and you're having multiple flare-ups and it's just constant, instead of, you know, just taking the pill, you can do a desensitization. So what you do is you get tested for all these, you know, it's by location.
Okay.
So we pick the trees and the grass that are common here.
Okay.
You know, so we pick the allergens and then we test them on your body. I brought pictures.
Yeah, I see that.
So this is that's the tester. So you can put 8 or so. There's a control in there, control positive and a control negative. And you dip those in the allergens that, you know, various trees, grass, pollen, cat, you know, dog, all that.
Okay.
And then you place them on the body, and it's not a needle, it's more like a scratch. We call it the scratch test.
Okay.
And so you just kind of apply pressure. It's not painful. And then you have, the worst part is waiting, because it just itches like crazy.
Oh, and you can't itch it,
can't scratch it, and you wait for,
so you wait for this, basically,
This is, you know, pretty much, mine was worse than this. I couldn't find my picture, but so you can see which ones are positive.
Yeah.
So the goal is you go in after, you know, you wait for a little while. You look at the control positive that you did, which is just basic histamine, which is an inflammatory reaction in your body. And the reason that allergy testing, we don't do it in the spring, you have to be off of your antihistamines for a week or 10 days before we can do this, because we need a positive histamine reaction.
That can be brutal for some
so
folks.
We don't test people in the spring because that is mean. And so, but we're going to plan at our clinic, we're going to start up with allergy testing. And so you go through the test and you look, we figure out what's positive and kind of write how big your reaction is, and that tells us how allergic you are to it.
Okay.
And then we send off, you get a serum back. You get 4 vials of serum, and they kind of increase in intensity. They start at clear and they get up to a nice brown color.
Okay.
And it mixes all of your allergens
into
a vial.
Yeah.
Based on your reaction.
Okay.
So if you're super allergic to cats, it's not going to put a lot of the cat in there.
Okay.
It's put in smaller amounts. So it kind of goes based on your... and so then you come in for immunotherapy, which is just a tiny little injection every week.
Okay.
And you gradually work your way up based on your reaction to that. If you have a big old welt, then you're not going to go up to the next one.
Sure, yeah.
But you work your way up, and the goal is after, you know, 6 months or so, you're not having to take as much allergy medicine and things like that.
Progressively can get better. If this is something you're interested in, make sure you contact Baptist Health. You can call the number on your screen or go to baptist-health.com. Dr. Lester, always great to see you. Thanks for coming in today.
Thank you.